Well, hello, this is Steve Long. I'm the CEO at Hancock Health, and this is another version, actually a special version, of Facebook Live. Thanks very much for joining us again today. You know, we do these every week, and we talk, really, we've been talking for the last many months about COVID-19, the coronavirus, and the pandemic, and there are many bits of information that we continually share, but it is my pleasure to introduce a special guest that I have today, Chief Jeff Rasche, who is the Chief of Police for the Greenfield Police Department, the City of Greenfield. Thank you very much for joining me.
Thank you very much for coming here today, Steve.
Well, it is a pleasure to be here, and thank you for giving us the use of your office. I love your office, by the way. This is a wonderful place. And I will tell you, the reason that we have the Chief here today is that we wanted to talk about an experience that he had with COVID-19. And I am just so thrilled that he is willing to share that experience and that story with us, because it is not something we get to hear firsthand about all that often. Now, we see it at the hospital all the time, but I think it's more impactful when people actually tell their story. So can you tell me, what did it feel like when you learned, we're not going to ask how you got it, but we're just going to ask, what did it feel like when you learned about it, and then what was your journey?
Yeah, so, you know, I've talked to a lot of people that have been infected by this virus, and it seems like there is really not too much of a common denominator with this, other than it's just horrible. And so you hear many different avenues that people have taken during this. Mine, at first, when I first discovered that I had to go get tested and then eventually found out I was positive, it was in the middle. It was November the 2nd, so it was, if you remember back, it was nice and sunny and warm, and so I'm out cleaning my garage, I'm cleaning windows at home, so I'm doing all these things because I can't go anywhere, so I'm confined to home, and so it was okay, and I'm like, okay, this is good, you know, I think it looks like I'm going to be okay. The second week, however, came and snuck up on me, and so, you know, thankfully, as you can see, I have rebounded. I've made it through, for the most part, unscathed. However, you know, you have to think about, in that time period that I live alone, just me and my house and my dog, and you know, you have these periods that you go through that you wonder what is going to happen, because social media is very powerful, the news is very powerful, and you see and you hear, and a lot of people don't realize, and maybe it has really hit home even as of yet, just how dangerous this virus is. And so I found myself laying there, kind of like Groundhog Day. You go to bed, you get up, and you know, eat a little bit, and you hit the couch or go back to bed, and this overwhelming fatigue, and you know, the great big bottle of Tylenol for the headache, and you know, trying to keep hydrated, and so all these different things, and so I would wake up literally every day, and I wonder, well, what's going to be next, and what am I going to be facing, and so you know, from that second week, third and fourth week, you know, it was very unnerving. I started having some very unusual heart rhythms, and I've talked to some people who have experienced this very similar thing as well. And so, you know, my friends and nurses and doctors, and they're like, you gotta call your doctor. You gotta get on this. And so at first I put it off, and I was trying to get out and get some exercise and some walk and stuff. And then I was having problems doing that. So I did, and so my doctor says, you know, let's get you on a heart monitor for 30 days. And so, you know, just hearing that coming out of his words, you know, I'm 54 years old, relatively healthy. You know, I used to run marathons and do all these things. And, you know, it really kind of set me back a little bit. And, you know, from the physical side of it to the emotional side of it was very powerful for me. And, you know, a lot of people still don't understand that. There's some people that may or may not have been affected either by themselves being positive or their family, but this is very, very, very real.
Wow. Well, we are really thrilled that you recovered so well.
Yeah.
Because you look great.
Thank you.
You sound great, so
yeah.
You made it through just fine, and we are very happy to hear that. So, yeah, congrats on that.
Thank you.
You know, the thing that this tells me, and it is a reminder for all of us, that COVID-19 is a very real disease. And it is caused by this virus that is transmitted silently, and you never know where you might pick it up, because it can be anywhere. And when you get it, for many people, they don't even know they had it. but they spread it, right? So who knows who is gonna be that second or third person down the line that actually gets it from someone who spreads it. And then for some people, they really have a pretty good experience with it. It's just kind of like a mild cold. Others have the experience that you have, which sounds really like a very, very bad flu, right?
It did, yeah, for the most part. That's exactly how I felt. But I will say, going back to the, not to interrupt Steve, but you were talking about not knowing that you have it. And I would have probably bet a paycheck when I went that morning to get tested that I wasn't gonna be positive. I mean, I felt absolutely great. I'd been outside and, you know, it had been a nice weekend, and I would have bet anything that I wouldn't have been sick. And so there are a lot of people that we probably are around every day, that feel that very same way, and that are maybe possibly infecting people if they're not wearing their masks, and we don't wear our mask and wash our hands and do the things that Steve Long and your great staff preaches to us every day to do. Very important steps. You know, we have to do that here at the police department. We sanitize the building, the doorknobs and the light switches and our vehicles, and we have to do all these things to make sure that you know, we're protecting not only ourselves but our families, you know, the officers' families when they go home. And you know, my dad is 80 years old. When I found out that I was positive, I was scared to death that he may very well have been infected by me. Now he's in very good shape. He was actually playing golf the day that I found out that I was infected, and he and I had been together in a car on Saturday before that, and so I was very worried that you know, that I may very well have infected my father, who is 80, and you know what's going to happen. And so thankfully he never did. He was tested a number of times, but never tested positive, and he remains healthy today. But you know, he especially, even after having had this, you know, we take extreme precautions. I do not want him to get sick. I have friends and family and know people that have infected elderly loved ones, and they have passed away from this, and this is real. We have a very, one of our officers' family have experienced this. And so I know it has been very difficult for that family, carrying a little bit of the burden around that. They infected their loved one, and they passed from this.
It is such a good reminder of how serious this is, right? I mean, we can make light of it sometimes, but it is a very serious disease.
Yep.
The good news, and thank you again for telling us your story. I mean,
Sure.
that is what is most meaningful, is when people hear it from somebody who had it and they can say, wow, it's real, right? And I love that image that you have of, hey, I thought I'd be the last person in the world that would get it. And there it is.
You're right.
So on the bright side, we now have treatments that we did not have before. So we actually have an infusion center that we've stood up at the hospital that is doing monoclonal antibodies. So for those that are most at risk and have symptoms and they have some underlying health conditions, we can really do some interventions with them now that we couldn't even just a few weeks ago. So we're very excited about that. Probably the most exciting thing though is the vaccination. We are mere weeks away from beginning to put needles into people's arms with the vaccine. And I just want you to know that Hancock Regional Hospital is a phase 1A site. So we expect in about 2 weeks that we'll be vaccinating our healthcare workers and the long-term care workers and residents and the first responders, and then working our way through the rest of the county in the weeks and months after that. So there is a light at the end of the tunnel.
There definitely is.
There is. We want people to just remember, it's not over yet. The light's there at the end of the tunnel. There are things that we can do, and you pointed them out. We gotta wear a mask properly, right? Which is the thing. Wear our mask, we gotta wash our hands, we gotta keep our distance. Those are the things that are gonna get us through to the end.
Most definitely. And you know, I can't walk out of this interview without thanking you, Steve, and all of the staff at Hancock Regional and, you know, throughout Central Indiana. I am friends with nurses and doctors throughout, and I know you are overwhelmed. And you know, I think that that falls on the hands of selfish citizens that aren't following the rules and doing things that they need to be doing. And so from my standpoint, in this community, I can't thank you and your staff and all your doctors and nurses enough for what you guys continue to do every day to try to make people well and keep people well from this horrible virus.
Well, thank you, Chief. And I could not be more proud of the the people that work at Hancock Health, all of the people that work in healthcare, and I just want to say, it is overwhelming. We have a full hospital right now, and we have more patients coming every day. And so we can all just learn the lessons that you did, and if people will listen to your story, do those prevention techniques, that is the key to getting us to the end and getting to the light at the end of the tunnel.
Let's do it.
So Chief, thank you very much.
Very good. It's
Great
great
talking to you today. And thanks for joining us on Facebook Live. We'll talk to you again next week.